I've just attended one of Claire's conditioning courses. She's an absolute fountain of knowledge. I've got a massive amount of information from today, and I feel I've got a million and one questions that I want answering as well, and she's got most of the answers, which is great. So a big thank you to Claire, and I'd thoroughly recommend going on one of her courses.
Myself, my background, I work in rehabilitating soft tissue injuries. For anybody within my sort of field, or physiotherapists, chiropractors, osteopaths, anybody working to rehabilitate their clients, thoroughly recommend doing this course. Thank you.
Hi, I'm Dr. Claire Minshall, founder of Get Back to Sport, and I'll be taking the Strength and Neuromuscular Conditioning for Rehabilitation course for you guys in Tel Aviv. So let me ask you a question. When you're trying to improve a patient's strength, how many repetitions do you prescribe? Is it 5? Is it 10? Is it 12? Is it 15? And what makes them stop at that number of repetitions? In this course, we will be looking at the specificity, the progression, and the overload. Those are the 3 key principles that you need to address when you're designing a progressive resistance training program that promotes long-term and sustained adaptation in muscle strength. In addition to that, we'll be looking at the hierarchy of importance of muscle strength alongside other functions of neuromuscular performance. So think about an injury scenario. It takes less than 1/3 of a second to rupture your ACL. So we're thinking in these situations, it's not the maximal muscle strength that's the most important, it's the ability to develop a meaningful level of force very, very quickly. So that's a rate of force development and the electromechanical delay, the switch on times of muscles. Did you know that these elements of neuromuscular function require very different intervention than does a strength training or a strength rehabilitation protocol? So we'll look at the theory, we'll look at the hierarchy of importance of these aspects of neuromuscular function, and we'll look at how we can intervene to adapt them in rehabilitation settings optimally. And we'll also get into the gym environment, so you will learn practical techniques to optimise your rehabilitation interventions with clinical populations to ensure an efficacious and advanced rehabilitation of your patients. So these courses sell out pretty quickly in the UK, so make sure you don't miss out. I look forward to seeing you soon.
Strength and neuromuscular conditioning training course with Dr. Claire Minshall, and it was absolutely fantastic. I've got a toolkit full of ideas that I can implement into my practice straight away on Monday. Her knowledge and her ability to get the knowledge across to us in the audience was fantastic. I thoroughly recommend it, and yes, brilliant. Well done, Claire.
It's one-day strength and conditioning course, and I'm mind-bogglingly full of ideas and suggestions. I've quizzed Claire all day as a font of knowledge, and I can't wait to see course 2 really, because I've got loads of clinical applications I can apply to my patients on Monday. So I'm thinking that my patients are going to be discharged super fit and knowing exactly what they're doing and clear guidance. So yeah, I really would encourage you to go on one of her courses. Thanks.